Assalamualaikum everybody, I hope you all are doing well. Today we'll be talking about Mycobacterium tuberculosis, how it is responsible for causing tuberculosis, its morphology, and others. But before getting into the video, I'd like to tell you guys that these videos are meant for educational purposes. Things and treatments may change with time. If I get wrong or miss anything, your input is always welcomed in the comments section. So, have a cup of tea and let's get started. Mycobacterium tuberculosis is an acid-fast bacillus. Bacillus means it's a rod-shaped bacterium, so I've written rod shape here in the second line, and it is also cylinder. It is an obligate aerobe, which means it only lives in the environment where there is lots of oxygen. So we can call it a strict aerobe. It needs oxygen for its survival. It has a waxy cell wall. Why it has a waxy cell wall? Because it got mycolic acids in its cell wall, which make its wall lipid rich. And the reason it is acid fast is that it is resistant to decolorization by acid after staining with carbonyl fusion. It is acid fast. The term acid fast refers to an organism's ability to retain the carbonyl fusion stain despite subsequent treatment with an ethanol hydrochloric acid mixture. The high lipid content of its cell wall makes Mycobacterium tuberculosis acid fast, and it is responsible for causing the famous disease tuberculosis, also known as TB. In this picture, you can see the rod-shaped cylinder Mycobacterium tuberculosis. Mycobacteria is a group which includes different bacteria like Mycobacterium tuberculosis, the topic of today's video, atypical Mycobacteria, which is not a single bacterium. It also has certain bacteria in it like Mycobacterium avium intracellulare complex, like Mycobacterium cansazii. And there is a third bacterium in Mycobacteria group, and that is Mycobacterium leprae. Mycobacterium tuberculosis has the word tuberculosis in it, which comes from the word tubercle, which means round nodule. So, tuberculosis means multiple round nodules. Here you can see these round nodules in the lungs, because the site of infection for this bacterium is lungs. The reason is because it needs the area with the highest oxygen, because it is an obligate aerobe. There are two types of tuberculosis. Number one, the latent infection. It can be the primary infection when the person gets the infection and shows mild signs and symptoms. Or it can be the infection that when the person gets the infection and the bacterium lives in its dormant stage. So this is the dormant phase. And when the immune system gets compromised, either by old age or by AIDS, the acquired immunodeficiency syndrome, this infection becomes reactivated. It starts to show signs and symptoms, and it spreads not just within the body but to other persons as well. This is then termed as active infection. In a nutshell, tuberculosis has two types: latent infection, which can be primary or dormant, and the active infection, which is the reactivated infection. Mycobacterium tuberculosis produces certain virulence factors which play a major role in its pathogenesis. Number one is the cord factor, that is trehalose dimycolate. Virulent strains grow in a characteristic serpentine cord-like pattern, whereas avirulent strains do not. Number two in the list is that this organism also contains several proteins, which when combined with waxes elicit delayed hypersensitivity. These proteins are the antigens in the purified protein derivative, PPD skin test, also known as tuberculin skin test. And lastly, a lipid called thiocerol dimycocerosate. This lipid is located in the bacterial cell wall and is required for the pathogenesis in the lung. As we've talked earlier, that Mycobacterium tuberculosis has a waxy cell wall, which is due to production of mycolic acids, which are long-chain fatty acids from C78 to C90. This bacterium is acid-fast because of this waxy cell wall. And this cell wall makes the Mycobacterium tuberculosis hard. So it is resistant to acids and alkalis. Sodium hydroxide is used to concentrate clinical specimens. It destroys unwanted bacteria, human cells, and mucus, but not the Mycobacterium tuberculosis. This bacterium is also resistant to dehydration and therefore survives in dried, expectorated sputum. This property may be important in its transmission by aerosols. Mycobacterium tuberculosis resists weak disinfectants and survive on dry surfaces. Here, I would like to take a moment to introduce you to Medical Parasitology MCQs ebook. This is the Parasitology Practice Questions ebook. It is recently launched by medzukhruf. If you guys are interested, it will only cost you $12. You can buy it using the link in the description or the top right corner. Enjoy learning. Before talking about Mycobacterium tuberculosis in much detail, we should know about the bacterial classification. Bacteria are further classified into spirochetes, acid-fast. There is virtually only one bacterium that is acid-fast, and that is Mycobacteria. But there's an exception, that is Nocardia asteroides, which is responsible for causing nocardiosis, is also an acid-fast bacteria. Bacteria are also classified based on gram staining into gram-positive and gram-negative. Bacteria are also classified into mycoplasma. We are done with all of these bacteria. If you guys are interested, be sure to check out the channel. Lecture outline. We are done with the introduction of Mycobacterium tuberculosis. We have talked about bacterial classification. Now we'll be looking at its morphology, habitat in transmission, pathogenesis, clinical findings, lab diagnosis, treatment, prevention, and at the end, as usual, we'll review the lecture. Morphology. Mycobacterium tuberculosis is a rod-shaped bacterium, and it is 0.2 to 0.5 micrometers in diameter. It is acid-fast bacterium. The reason is it has got a waxy cell wall due to the production of mycolic acids. And these mycolic acids make its wall lipid-rich. And this high lipid content in the cell wall make Mycobacterium tuberculosis acid-fast. Structure. It has a waxy cell wall that contains mycolic acids, so long-chain fatty acids, from C78 to C90. And it also has got some proteins on its outer surface. That's its virulence factor, which play a major role in its pathogenesis. Habitat. Hosts. Humans are the natural reservoir of Mycobacterium tuberculosis. Its primary location is the lungs because it needs areas with higher oxygen because it's an obligate aerobe. Other locations include kidneys and reticuloendothelial cells of tissues. Although some animals such as cattle can be infected, transmission, Mycobacterium tuberculosis gets into the human body via inhalation. When the respiratory aerosols are coughed up by a person and they are inhaled by other person, this is how tuberculosis is transmitted from one person to other. It not just only spreads from person to person, but it also spreads within the body. And within the body, there are two mechanisms responsible for its spread. Number one is tubercle erosion. A tubercle can erode into a bronchus, empty its caseous contents, and thereby spread the organism to other parts of the lungs, to the gastrointestinal tract if swallowed, and to other persons if expectorated. Don't worry, we are going to talk about these difficult terms in just a moment. And the second mechanism is the dissemination via bloodstream. Mycobacterium tuberculosis can disseminate via bloodstream to many internal organs. Dissemination can occur at an early stage if cell-mediated immunity fails to contain the initial infection, or at a late stage if a person becomes immunocompromised. Risk factors of tuberculosis include elderly people, malnutrition, poor housing, genetic factors, and AIDS, the acquired immunodeficiency syndrome.